Hello, my name is Moncivaiz. This is my certification video for adult and child CPR. So the first thing we're going to do is we come into a room and there is an unconscious person on the floor. So what do? We perform our 3 C's. So we check, call, and then care. So we check the scene, make sure everything's safe, and then we check our victim. So we're checking to see if they have any life-threatening conditions. We're checking to see if they have any clues as to why they would have got this way. We're checking to see if they have a medical alert tag. And then we're also checking to see if they have like excessive bleeding. We're listening to see if we can hear them breathing. I'm also watching to see if the chest rises. Hey, can you hear me? Can you hear me? We're tapping, we're yelling, and there is no sign of them being conscious. So what we're going to do is, if we have our cell phone with us, we're going to call 911. Hi, 911. My name is Mary Moncivaiz. I have an unconscious victim at this place. Please send help. Okay, and then if you do not have a cell phone and you're in a public area, have somebody else call 911, or have and also have somebody else go bring you an AED, and then you're gonna shout and say no signs of life, starting CPR. And after you do that, you are going to get the hand that is closest to their feet, and you're going to look for the inside part of the rib, and then you're going to move your hand up to the xyloid process. You're going to put your middle finger on the xyloid process, and then you're going to shift to your index finger above the xyloid process, and then you're going to take the hand that is closest to their head, and you're going to use the heel of your hand and place that above your index finger, and then you're going to get the hand that is closest to the feet, and you're going to interlock your hands, okay, and over the other hand, and then you're going to lock your elbows into place, and then you're going to make sure your shoulders are above your elbows, right? And then we're going to do 30 compressions and 2 safety breaths, and make sure this is done in the span of 18 seconds. So we're going to go 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, all the way to 30. Okay, we have a protective guard or a safety mask, and we're going to put this over their mouth area, and then we're going to do the head tilt chin lift. So we're going to tilt the chin upwards, and the reason we do that is so the tongue can move out the way, and then you're going to pinch the nose and take a second breath while watching if the chest rises. The reason we only breathe in their mouths for 1 second is because if we breathe for anything longer than that, the air could go to their stomachs, and so when that happens, it could cause them to throw up. So if this is the case, if they do throw up, what we're going to do, we're going to put them in the recovery position, let them throw up, then we can do a finger sweep, make sure all the stuff is out of there. Okay, we put them back in recovery position. Okay, you're going to pinch the nose, tilt the chin, safety breath, watch. And every time you do that, you're going to make sure to pinch the nose and unpinch it. So after you pinch it and blow, you unpinch it and see the chest. Well, you're actually supposed to see the chest while you're breathing in their mouth. So then you do another one. So like I said, you go to the xyloid process, get the heel of your hand above the index finger, and then interlocked, and then 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10. And you're going to continue all the way to 30, and you're going to continue to do this until the AED arrives, until you're too tired to continue, until a health professional comes and takes over your place, until the scene becomes unsafe, or until the victim becomes conscious, which if they do become conscious, you're going to put them in the recovery position on their side, and you're going to monitor them until anything changes. Okay, also for a child, what we're going to do, the difference is that you have to ask permission or gain consent from their legal guardian, or let's say you have to call 911, you have to do 5 cycles of 30 compressions, 2 rescue breaths in 18 seconds before you yourself call 911. So after you do that, you are going to put them in the recovery position, call 911, tell them what's going on, and then you're going to put the phone down and then continue with CPR. And that is how you perform adult and child CPR.